the coccyx, so we kind of do want to make it a little bit lower. So everyone's sacrum is a little different. Some are really thin and narrow, some are a little wider. So we're kind of just finding our anatomy. I should be doing this without, no, so now I feel cold. GV30 is cold. So the sacral fan is when we're going to start by the coccyx, and we're going to do a line up the spine, and then kind of in the middle of the sacrum, and then the lateral border. And again, I'm spending 45 minutes moxing her front, getting her super warm and cozy, and then I'm going to flip her over and warm her back.
Feels really nice.
Good. This is really good for any kidney yang deficient person. If they have low back pain, if they have low sex drive, this isn't, the elderly love this one because it really helps strengthen them. So anytime people come in really weak and tired and cold, this is so, so good. I feel like I'm the Moxa queen. I get paid to do Moxa. But I teach people to do Moxa because I want them to do it at home too. But I do oftentimes 10 to 30 minutes of Moxa with each patient. And I live in the Arctic freaking cold too. It's so cold there. It's crazy.
So nobody complain about the smell about Moxa?
I have air filter in each room, and I have window open. So because this is smokeless, this seems to not have any problems.
No.
When I had regular Moxa, it was a very big problem. And then I would also just feel gross at the end of the day with the amount of Moxa. I would too. I would go to the supermarket and people were like, what is she smoking? Why does she stink like that? I don't know. I didn't like it. But really, all the places where I treated, initially I was able to do regular Moxa, and then it just became like smokeless was our only option. So I'm literally going to keep palpating, and until I feel everything's warm, I'm just going to keep going. And sometimes I might do no points. I might do 1 point. And I encourage you guys to do less is best sometimes, where just do a yin tong, you know? Put in a yin tong and have her tell you her birth story. You know, play with doing 4 gates sometimes if you want to move chi and blood. Just that, see. Because a lot of times people are just over-treating and choosing too many points. So especially someone postpartum, we would really want to minimize those points. And even pregnancy. A lot of times I'll do 10, 12 needles max, especially if they're deficient. If they're excess, we could do a lot more. It's interesting, more cold on one side. But yeah, this is, so doing it in the line is how I was taught by Heather Bruce. She's from New Zealand, one of my mentors, and she's a midwife and an acupuncturist. And I just feel like I just warm the area. I just keep palpating, and it really feels really good. And then I usually teach them to do it. But I have a lot of videos on my YouTube channel teaching people to light and extinguish Moxa, to do it for breech babies, to do it for this, for that, so that I can just be send them a link so that have your husband call me if he has any problems or something.